No other word engenders as much fear, revulsion, despair, and utter helplessness as AIDS. It is, in fact, rewriting medical history as humankind's deadliest plague. With well over 30 million deaths to date, statistics tell their own tragic tale. As I've previously mentioned, AIDS is one of the most ruthless diseases in the world today. Since its discovery around 30 years ago, it has already managed to take over 30 million lives. 1.7 million lives were taken in 2011 alone. However, Africa is affected more than any other place in the world. Currently, 25 million Africans, many of these being children, are infected with the disease. Now, you are aware that AIDS has impacted the lives of millions, but how is it transmitted? Transmission can occur a number of different ways. 1. Sexual intercourse with an infected person is one of the most common ways to contract AIDS. 2. Another means of spreading the disease is by the use of sharing needles with a person who has been previously infected. 3. Perinatal transmission, or vertical transmission, occurs when a pregnant woman transmits HIV to her child. And 4. Although not as common anymore, blood transfusions have also been a contributing factor to the spread of this disease. There has been no discovery of a cure yet. However, there are a couple methods being practiced to treat patients with AIDS. One method that is used to keep the virus under control is prescribed medications. Antiretroviral therapy, or ART, is also a common form of treatment and appears to be more promising than prescribed medications. Some antiretroviral drugs have known to completely stop the virus from reproducing, while others have even managed to block it from entering the body's cells. To reduce the spread of this disease any further, there are certain precautions that can be taken to prevent this disease. 1. Do not engage in unprotected sex. This includes multiple partners, a person who is suspected to have AIDS, or someone who uses IV drugs. It is also incredibly important to either use a plastic or latex condom to reduce your risk if you are sexually active. 2. Another precaution that should be taken is to refrain from the use of IV drugs or sharing needles. 3. It is imperative to avoid exposure to blood from injuries. In any case, it is impossible to tell if the injured person is AIDS-free or not by just looking at them, so always treat the person as if they are infected. 4. Although blood transfusions do not pose a very high threat in the United States, other countries are not so fortunate. If you live outside of the United States and have a transfusion, get tested immediately. Unfortunately, AIDS continues to affect the lives of millions each and every day, even those who aren't infected with the disease. You may be thinking, well, how is that possible? Every day, children become orphans because of this horrible disease. In Africa, this occurs every 15 seconds. In 2009, it was estimated there was nearly 16.6 million orphans aged 0 to 17 years. Of those 16.6 million, 12 million orphans were living in sub-Saharan Africa. Usually when this occurs, the orphans are forced to leave school in order to find work to support their households, or this may be left up to the responsibility of the eldest child. Sadly, many of the children without work may turn to prostitution in order to make a living. This increases their risk for contracting the AIDS disease. It is evident that AIDS is a deadly disease that has taken millions of lives and continues to affect the lives of many others around the world today. It can be transmitted in several ways and completely alter the lives of those it infects. Although there is treatment available and preventative methods that can be taken to reduce the risk, there is no definite cure as of yet.